Welcome to our heart-to-heart town hall meeting today. I'm so excited about today, and it's so important for us to talk about behavioral health. And so we have the experts with us today. I am Cheryl Jackson, and of course, we're here at Praise 104.1 and Spirit 1340. We're excited about all of you guys who've joined us today. We want you to share, tell everybody about it. It's our heart-to-heart discussion about behavioral health. Now, my special guest tonight is Dr. Valina Shaw. She's the medical director for the Behavioral Health Division of the Prince George's County Health Department. And she is a triple board certified physician in the specialties of general adult psychiatry, child and adolescent psychiatry, and addiction medicine. Welcome, Dr. Valina Shaw. How are you?
Thanks for having me.
Good to see you. Good to see you. And I also have with me a special guest, Dr. Otelia Hunter. She is a licensed clinical professional counselor, approved supervisor, and licensed clinical alcohol and drug counselor, approved supervisor for the state of Maryland, as well as a licensed professional counselor in the District of Columbia. So as you can tell, they are well versed on the topic of behavioral health. Welcome, Dr. Hunter.
Thank you. Thank you for having me.
Listen, I believe this is going to be a great and provocative conversation tonight for our viewers. And listen, if you have a question as a viewer, if you have a question for any one of the doctors, or if you want to comment on any of the things that we're saying, be sure to do that. We want to make this conversational. We want to make it an opportunity for you to dialogue and get all of the information that you need with regards to behavioral health. We're dealing with this pandemic, and a lot of people aren't doing well in it. And we really want to be able to help you guys get through it, okay? So let's just jump right in. We all know that this has been a stressful period for all of us. But what about this year, in your professional opinion, has made it so tough and so hard? Either one of you guys can jump right in.
Well, thanks again for having us. And, we come on behalf of the county executive and Dr. Carter, our health officer, and Dr. Askew over our department. And, I think the biggest piece of this is that I don't know how many times we have said the word unprecedented in the last ever in our lives. Mm-hmm. Unprecedented has become part of our vocabulary like never before. And a big part of this is that we've never gone through anything like this before. And, it goes against all of the basic tenets that we have of disaster psychiatry, disaster medicine. Whenever something bad happens, you say, pull people together, get us out of it, and let's get us back into our normal supports and normal routine. Well, we can't just get out of it. We're in this pandemic. We're in it for a long term, even though there is hope right now, especially with the vaccine, there is hope, but we're in it. Right. And then when it comes back down to it as well, we can't just say, well, let's just, go see your friends, see your family. You can't just do that anymore. And that's taken that away from us. And then our routines have been so disrupted. When you think about, we're on praise, right? Going to church every Sunday, mm-hmm. seeing the people that you used to see. You just think about just all of even smaller things like our coping skills and strategies that we had built into our lives that we lost, praying in the car, or doing some other things that you had time to yourself. Those other things we took for granted. It's all made it really hard, and all the stressors just keep piling on, and especially with the disparities. So I'm so thankful that we're having this conversation so that we can talk about how to overcome this.
I want you to address that as well, Dr. Hunter. Some of the reasons why you think this year has made it so hard. We know of the pandemic, but just from the clinical side, just from the perspective of a physician.
Well, actually, Dr. Shaw is the physician. I'm the clinician.
I'm just
we have to keep our humor in this.
Yes, but we work together like a team. We're two pieces.
We do. We always work together. I think one of the key things, and with all the things that Dr. Shaw said, is we kept hearing early on social distancing. And really, it should have been physical distancing, but trying to stay connected socially. And as she stated, when you normally go through things, the first thing you do is you want to go see somebody. You want it to be a place of comfort, whether it's church or a friend's house or a family member's house. And we need that consoling. And so to not be able to do that, even over simple as Thanksgiving, if they were saying, don't mingle families, don't mingle your household with somebody else. So it isn't even about family, because we have family, but now you can't mingle your household. And so to not have that connection is very, very difficult for us, because we are a communal people. That's what we do. We come together over food. We come together and we laugh. We just do things together. The gym, the very simple things in our lives. We lost that. And early on, especially when we were all shut down and with so much uncertainty, I think that's what made it very, very difficult. And so you're trying to create a new norm in the midst of something that you've never gone through before.
Yeah.
And so, when we talk about it being stressful, that is a huge stressor where people are dealing with, and then the everyday things. And what about the people who couldn't go to work or lost their jobs? I have a young adult son who went to work one day and they said, your services aren't needed anymore. Wow. He has the ability to be able to come home, but there's somebody whose whole family was depending on them. And so it's that much more difficult for those people. And so, we talk about the impact on us, not just socially, but mentally, financially, all of those things play a part in what we're going through right now. And it is very, very difficult.
And I'll add as well, just as in this time period, it wasn't just the pandemic. We also then had the racial justice movement and the social justice movement that got added as well. I mean, I personally thought I hit my new stride. I found my new norm. I'm making my way. I'm going to take a little break. And then all of a sudden you have, the George Floyd incident. And that added to the compound of stressors. And, there's a lot of memes and things going on around 2020 just being such a challenging year. And I think between that and then even election stress for so many, I mean, it kept pounding on and compounding. And I think that the key piece was just wading through it and knowing that they're all connected. Even COVID was connected to the racial justice movement, because when you think about it, who was getting more COVID was Black and brown people, right? And so when George Floyd hit, or when that hit the news, not that racism hasn't been here, but when that all hit the news, it was like, well, we were experiencing this and we were dying just one by one by COVID before. And so now we put it back in our face that we're dying one by one in other ways as well. And it was, I think, that addition that made it so hard. And the viral impact of on the disproportionate impact on our community is the same disproportionate impact on our behavioral health as well. That the impacts that we're going to see for years. I believe the fallout from this, if we don't have these continuing conversations and folks get into help.
Right, especially in our community, because when you're starting to talk about mental health and how it affects us, we kind of brush it under the rug. On the physician side, we take some ginger ale and we keep it moving. So we're not going to the doctor like we're supposed to, and we don't want to have the stigma that we're crazy, or that we're dealing, that we don't know how to deal with stuff, and so we hide it. And I think that piles on the stress. I saw one comment of a sister saying now she's stressed out whether the vaccine is going to be genocide. So now we're wondering, you know what I mean? So now we have this whole other thing that we've called, stresses. Here we are, trying to find a way to curve Covid-19 and give us a vaccine and a cure. And everybody's wondering, am I going to die from it? So now it's a whole other stressor. And I think, like you said, with George Floyd and the whole racial unrest as it piled up there, it's because we're home and we're watching it. You know what I mean? I think it magnified. And then, we had a president that was kind of fueling it and brushing stuff under the rug. And it just really magnified from one thing on top of the other, which is why I think this conversation is so important, that we are verbally talking about behavioral health in our community. What are the effects of stress and behavioral health on the body? Because I wanted to talk about that too, because both of you guys, you're saying you're being clinical, you being a physician. I know that stress can multiply into something else.
Well, the thing about stress that most people don't understand is it affects every part of your body, every organ in your body, including your skin. It affects your immune system. your hair, some people, they get stressed out and their hair falls out. It's just, there's no way that you can carry this amount of stress and it not impact you. And so it becomes that much more important to understand how stress impacts us. So normally we have a fight, flight, or freeze response. Well, we're not really in a position to be able to go through those responses the way we normally would. And so we don't finish that stress response, because where are we going to go if you're the one who is the flight person, right? You have nowhere to go. And so being able to know that you are going to go through some people who, and I talk about this also when I was talking about individuals who couldn't go to the gym. So the ones who normally would go to the gym to alleviate stress, they can't do that anymore. And then what about the people who already had underlying behavioral health issues?
Right.
Those were exacerbated by all of this. And so now you may have said, I struggle with a little bit of anxiety in my life, but I've always done pretty well. And then you have something like this hit, and then on top of the social issues that we see, and your body all of a sudden is overwhelmed. You don't have a way to deal with it because you've reached your max. And you start going through things that you hear about the people, everybody jokes about the gaining weight and things like that. But for some people, that's how they deal with stress. They eat. And for others, they may resort to some anxiety behaviors and not really sure about how to deal with those. And even if you're a person who, one of the ways that you dealt with it was through your faith base, you didn't have that anymore. And yes, I know we can connect through Facebook Live and things like that with our churches, but it's something about walking in that.
Something about that live experience.
Yes, and somebody hugging you, or you go up to the altar because you need prayer. Well, we would have all been at the altar, in the midst of this. There would have been nobody in the seat, right? And so think about all the mega churches we have here in PG County. There wouldn't have been a soul in the seat. So we're trying to deal with this the best way that we can. But for a lot of people, they've never had to deal with this type of stress. And it impacts every part of who we are. Not sleeping, not eating, or eating too much. We know that alcohol sales went up. We know
they didn't close the liquor store.
They did not. And I'm going to let Dr. Shaw discuss why they didn't close.
Well, and I say, yeah, from that's a whole nother week there, no other conversation. but part of this conversation. But nonetheless, I think also stress puts you at risk for the behavioral health conditions, like we're saying, and then also there's some data coming out now that the impact of behavioral health conditions on COVID is bidirectional. Fancy word where it goes both ways. So if you have higher risk of having a behavioral health, or if you actually had a behavioral health condition before, you then have higher risk of having more severe outcomes from COVID and even possibly getting symptoms from COVID. We are noticing now that there are people who get COVID, and it's a relatively small percentage, so they say from the data, but we'll see when it comes all to light. But there's also a risk of having behavioral health effects from COVID. You just have life-threatening illness. Depression, anxiety, all are you're at high risk when that happens. And those behavioral health effects of that, and especially with stuff that looks like post-traumatic stress disorder, that's higher in those who have had COVID, post-COVID, and if they had diagnosis before. So have the effect of you have higher risk to get COVID, and then it happens on the back end too, and you can have a higher risk of having behavioral health concerns just because you had COVID. So it's not something to be played with, and not something to be brushed under the rug, because it can be life-threatening, just like any other medical condition.
Got it. So we do have a question from the audience. Dwayne's going to put it. He says, Karen Jackson says, what should parents be doing to assist students with coping with stress during this time?
Well, the first thing I say is to make sure you're managing your own stress, and acknowledge that we are human. I think that sometimes we like to put on the superwoman, superman cape and try to make our way through these challenges. But I have the greatest amount of respect for the people that can mute their computer quickly and yell at their child to make sure that they are still on their virtual learning, right? They know what they're doing and they don't have shame about it. Or they show their baby monitor. Their kid, they're checking on their kid to make sure that they're getting on. But I think that humanizes us, and it doesn't make us feel like we have to be these superpowers, because when youth see, and then when children see that in their parents, they're feeling like they're needing to be superpowers. And then they take that on themselves. So that's the first thing, is making sure that, you put your life vest on, you put your oxygen mask on before you start to work with the child. And while you're working with the child, it has to happen simultaneously. Then the next piece is when you're working with that little one, is first of all, just reassuring them and saying that it's okay. You're doing your best. We're doing our best. And making sure that there isn't, I know there's a lot of fear about the achievement gap and pressure on youth. And this is usually, as a child psychiatrist, this is usually the time where we have some of the most difficulties with our young people, just with behavioral health effects, going towards the end of the term or semester. It can be difficult. But I think that right now it's thinking about the hierarchy of needs, thinking about those basics and keeping those afloat. And as we're all doing our best, reminding that your child that they're doing their best. And there's other things that you can think about doing that not everyone has money to do. And I think, don't look at the Joneses, don't look at the people that can pay somebody to quarantine with them, or don't look at those people that can go to the private schools and pay the private schools and not be affected by the achievement gap. But you're doing your best right now, and that we will work through this together. I think that's the key piece. If you are seeing, though, that a child is really so distressed that they're not wanting to live, they're saying that they don't want to go on, they can't get in the Zoom, they're talking about just feeling so hopeless, not eating, not sleeping, just, start thinking about also getting them in treatment. Piece here is that, we're still open. We're still working. Telehealth was already there before the pandemic, but now you can have your psychiatrist, you can have your therapist, you can have your school-based clinician that's still working and just doing remote visits available via Zoom. If your internet goes out, the state has agreed to pay for telephone calls too. So you can still, there's still access to care and access to treatment. And don't feel like that superwoman cape has to be that you're also fixing your child's mental health. You're supporting them. Sometimes they might need an outside voice. Sometimes they might need just an outside outlet and some other safe space to be and to talk about that. And that's okay. Absolutely.
Dr. Hunter, did you want to add to that?
No, I concur with Dr. Shaw. A lot of times we don't understand that kids kind of feed off of our energy.
Right.
And so if they see that you're stressing and then you're telling them not to stress, it's not really do as I say, not as I do. That's not what happens. They do what we do. And so, I'll repeat what she said, get them help, but don't forget to get you help. Don't forget to make sure that you're getting the services that you need so that you can be there for your child. Healthy parents make healthy children. And a lot of times we're so focused on our kids, and I understand that. You want to be really focused on your kid, but you can't draw from a dry well. You have to make sure you take care of you first so that you can pour into your child. So make sure you take care of you so that you can take care of them. And it makes you human.
Yeah.
For them to see you. Yes, mom is stressed out today. Mom has a little bit of anxiety. I'm going to work through it, and we're going to work through whatever your issues are too. It makes you human to them. And, all of us, our parents were, our superheroes. But it also teaches them that it's okay to not have a great day, but you can push through that day and you can still have a great life.
Yeah. And the stressors of just, in-home education, that virtual learning. I'm noticing even one of my nephews, who is a straight A student, has had some challenges with just, because when you're home, they feel like I'm home. You know what I mean? Like I'm not, I'm supposed to be able to have some fun and run around. And it's been stressful, but it's a whole different ball game. And then parents have to wonder, how do I work from home? How do I go, how do I go to work and still deal with them? And like you said, if the kid already has some behavioral health issues, ADHD, I have a friend who has a special needs son, and, taking him he's able to go to school, and he has cerebral palsy, but to do that from home every single day and change their routine, that's a hard thing for parents to have to do. That's a real thing when it comes to behavioral health and dealing with our children during this pandemic. I don't think
Cheryl, I'm sorry, I'll add the other side of that. What about the people who are taking care of aging parents?
Mm-hmm. Exactly.
Mm-hmm. Right. So those parents used to go to senior centers, or they used to go out to day programs during the day, and now they're at home with them, and they're having to manage. For some people, you're managing young kids and your older parents all in the same household, and that is a very stressful situation.
Absolutely.
Yeah, there's data that shows that group is one of the highest groups of that has had an impact on their behavioral health, is caregivers of adults. That have had some of the greatest risk of having increased depression, increased anxiety, are caregivers of adults. And so it was about 66% in a June study from the CDC of caregivers from adults. And about a third of those in that study were caring for young children as well. So, and that was before, and that's over the summer when there really weren't, or when we were still trying to figure out virtual learning, and there wasn't the same pressure because we thought it was temporary. So, I think it's going to be, it's a difficulty. And I think once again, just, don't be super person, just ask for help as well. There are not all the same resources out there, but there are some. There are some resources that are available. We're all learning, we're all adapting. And so the beauty of this is that we have found ways from the behavioral health treatment side, from, the Department of Aging, that everyone's just modifying our programs to do the best that we can, and don't assume it's not there. And don't assume that because you tried it in March or April, that it's not there now. That's the other thing, is that, we were all getting this, there were bumps on the road because we shifted how all these programs and projects and clinics were running. But then after that, we have now modified. So don't give up and say that it's not there.
Got it. So these are the numbers that you see on the banner for those who are viewing. If you're dealing with behavioral health in the state of Maryland, take advantage of these opportunities. Take advantage of the phone numbers and the resources that's being shared. Some people just find this overwhelming and have had thoughts of hopelessness with all that's going on. We talked a little bit about some things that they should do, but let's move on, because I think we already addressed that particular question. What do you say to someone who's lost a loved one during this time, either from COVID-19 or another reason, especially because there's been restrictions on services, on funerals and things like that? And one of the things I want to add to that is that we're seeing a lot of, a record number of seniors dying. I know that in the church, we're seeing bishops and people who have governed our organizations who are dying by the groves. But not only that, we can't have the actual funeral services, but a lot of people that we're seeing dying right now the deaths are not COVID related. It's not COVID related. It's because, they may have had an ongoing condition that maybe this has exacerbated, or made it bigger, or has caused it to, resurface or whatever. But we're seeing a lot of people who are dying, and it's not just that it's COVID related. How do we deal with that?
Well, I think, Cheryl, that goes back to what Dr. Shaw was saying earlier, and what we talked about is how the stress impacts our entire body, right? And so it doesn't have to be COVID related. It's interesting. I was watching a the news this morning, and there was somebody who said that her sister died of COVID, but she didn't have COVID. And the reality was there was no room at the hospital for her sister to get the care that she needed. And so
that was COVID related then, right?
It was, in her mind, it was, but she had a heart attack. She had a massive heart attack. And so she couldn't get the care that she needed because there were no beds for her, and there were no beds at any hospital near her. But I think that the thing that we have to realize is there's layers to loss. And so you talk about, we've already talked about how we've lost the normalcy in our lives, and we've lost the ability to be able to connect with people the way that we want to. And so those were our norms. Then we lose our loved ones, whether it's because they had health conditions that were exacerbated by the stress, or because they had health conditions and they actually did, succumb to COVID. Learning how to deal with those layers of loss is going to be interesting. And it's going to be something that people have to do. So the thing about loss is it doesn't go anywhere. So grief doesn't go anywhere. And people always say, oh, with time, it'll be okay. And as a clinician, we're like, no, with time, you need to process it. And I always tell people, it's like that, the thing that you really don't want to drink, or the thing you really don't want to be bothered with, and you kind of put it on the shelf and you're like, I'll deal with it later. But later in the convenient time is never quite right. And then
there's a reason the Bible says there's a time to grieve, right? There's a time for that specifically. And if you don't do it at that time, it might not work out.
And it's why it was built in even during biblical times for us to grieve, because you have to go through this process, right? And so when we don't go through it and we just kind of pick up and keep moving, what we find out is we have what's called unresolved grief. And then it affects every part of our lives. And so when we think about the losses, the thing that we want to do is we want to stay connected. Family and friends become more proactive. You want to reach out to those people. You want to get the care that you really need. I'm going to go back to, you can do virtual telehealth. You can do telehealth. You can do virtual sessions. They're still doing them. We have providers in the county that are still doing them. And you can get the help that you need. Saying I'll be okay and just letting it go is going to be unresolved grief later that can cause you other issues on top of the stress that you're already experiencing. So then you've got stress and you've got unresolved grief, and your body's like, I can't do this anymore. And so you really have to reach out for the help that you need. So consider a new professional connection, like a therapist, to make sure that there's that this response to grief is what it needs to be. And that person will help you process that grief through. And sometimes, depending on who the loss is or what the loss is, it could take, up to a year. It could take 2 years. The original science was, it takes about 12 to 18 months. And then they did more research on it, and they're like, it depends on the relationship, how long it could take somebody to grieve. And so you want to give people that time. So going up to somebody and say, that happened a month ago, you should be okay. That's not how it works. No. And so being able to be understanding to those around you who have lost, and supportive and things like that are very important.
And along those lines too, I think when you talk about the relationship, there can be other elements of grief when you say have a resolved relationship, like a family member or someone that you didn't have a good relationship with, and that can complicate things.
Right.
Also, when we think about COVID, that, there's a possibility that, someone maybe got COVID from you, or somebody that, you got COVID from someone else that you cared for. And if you think about just the grief and the guilt that somebody could harbor if they, are holding on to the fact that their loved one got COVID from them and it was an accident, then those are the types of times when you might just want to make sure that you process that with somebody, because call that traumatic grief or complicated grief or things that it's especially when you have those resolved pre-existing emotional issues, it makes the grief so much harder, especially now without being able to communicate with people and their last days and things in the same way. Hospitals are doing a good job of creating, doing tablets and things when people are ill in the hospital. but Black folks will go in there about 3-4 folks roll up in the hospital, and then the doctor's team knows everybody, right? So when you can't do that, and then you feel helpless as a family member, and then you might feel like I could have done something else. I shouldn't have done something else. And those are especially the feelings that you want to make sure that you're processing with a counselor, but then also acknowledging them with friends and family as well, especially if you're, by yourself at home, or don't have any connections. Just continue to be proactive. I think we started this in the beginning with being that proactive, but then I think a lot of us have fallen off. And because it's no longer novel, unique anymore. And then we get, fatigue of all this too, right? Like, we're tired of looking at screens by the end of the day. Our bodies are not designed to take in the same type of relational cues that we're getting from these computers. We're supposed to be taking in human cues and human interactions, and it makes it harder to manage all that. So, I think that, don't think that just because you're by yourself, you're by yourself. It's just physical distancing, but find ways. I've started to notice that I'm tired of the screen. So at first I think we thought it was rude, but now I make phone calls so I can pace. I just get up and move, as opposed to Zooming sometimes, just so I'm not looking at the screen, and I'm able to just not feel like I'm tied to that piece of technology.
Absolutely. I can attest to, caring for the elderly and then not being able to be with my mom, who's in a nursing home. And we never wanted her to have to go anyway, because, like you said, in our community and African-American community, we're going to take care of them at home as long as we can. It's almost taboo to take them to a nursing facility. But after she had a brain bleed, we had no choice. Her physician said, you absolutely cannot take her home from here, because she needs around the clock care. And when COVID hit, and you're right, I mean, my days were leave the radio station, take care of my mom, make sure she had her dinner, make sure that everything went well throughout the day, and then go home. And now with COVID, I had to really exercise my faith to believe that God has control over her. Stay proactive. We we made sure we talked to all of her physicians, and I still do that on a daily basis. We get to FaceTime her. So we take advantage of those opportunities. But we just stay in constant communication with the nursing home, and she's been thriving, believe it or not. I mean, gaining weight, eating at 100%. And so what God shared with me is that I have to have faith that he's got it. I can't hold on to the fact physically and mentally that I can't be there, right? I can't, because I will make myself sick, worried, because I'm thinking I have to physically be there to make sure things are going well. And I was doing that initially. But a good girlfriend of mine had to share with me, if you believe by faith that God's got her, you have to believe that and leave it in his hands. Be proactive. But the way we have to believe that and hold on to it, because it's beyond our control. It's nothing else you can do,
This is definitely the year of not doing things in your own strength, right?
Yeah.
I think as much as we, try to do things in our own strength, and we have coasted in so many ways of doing that in the past, the COVID has said, oh, you try to do that. Okay. It doesn't work anymore. You try to do this, it doesn't work anymore. And eventually you can either try to push against, all the challenges of 2020, or, rest in grace and rest in your own faith and rest in that God's got it, because otherwise it will be, you will keep butting your head against the challenges of 2020. And you can either come out of this pandemic, stressed, depressed, hopeless, or you can come out of it growing stronger, hopeful, joyful, and learning things about yourself and the world in a different way.
You can come out better. You can come out better. You can.
Well, we come out better by faith, though. And that's the substance of things not seen and the evidence of things hoped for. We say that, but we don't live that.
Yeah.
So we talk about it, but guess what's happening right now? We can't see it. And we have to believe it. And you have to believe in the God that you serve, that he's got you and he's got your mom. And somebody posted about their aunt. He's got your aunt. He's the one that holds everything and everybody in his hand. So this is when our faith really kicks in. It's the substance of things not seen and the evidence of things hoped for. And we've been hoping for vaccines, and we've been hoping to just get through. Is it another month? Whatever it is that your hope is. You know, I love one day Dr. Shaw had on a shirt, and what was it? Hope
is not canceled.
Hope is not canceled.
Ooh, that's good.
Hope is not canceled.
That's good.
Yeah, but it was something you could relate to, and it's not canceled. It is absolutely there. And you know, we work in public health, and so you know, we don't always talk about where our faith is, but you know who has faith by the ones who are just kind of pushing through and moving through, and they're not succumbing to some of this. Because when that day is real hard and the meetings have become so much, it's your faith that's going to carry you, and it's going to allow you to go to bed that night and wake up the next day refreshed and ready to do it again and say, okay, what can we do today to really make that difference?
And this message is really refreshing from healthcare professionals, because I know that you guys rely heavily on science and, statistics and things like that. But this is really refreshing. We do have a question from our audience. So, okay, not seeing family and friends, but creating social distance circles that you do visit with has created a lot of broken relationships. How do we mend those when this is all over?
If they're true relationships, we're all going through the same thing. So, and to put it into perspective, Dr. Shaw and I, our offices were very close to one another, right? And so we would walk into each other's offices. We actually live walking distance from each other. We left the office in March.
Right.
And we still work together all the time, and we've had to create other circles. Things have happened and we've shifted and moved around. And I just use this as an example. But at the end of all this, I would think that you would be ready to embrace the people who you haven't been able to come in contact with. It's the old saying, if you love something, set it free. If it comes back, it's yours, right? Those same relationships, you may be, my whole family lives 3,000 miles away. They're not going to not love me because I couldn't fly home during the pandemic. They're just going to wait for the pandemic to be done. Or, Cheryl, you'll appreciate this. My 92-year-old father in August thought it was okay to get on a plane and fly to Maryland because he had a girl.
Oh, you forgot the bus. You forgot the bus, too.
Well, he had 2 trains, 1 bus, 3 airports, 2 planes, and a cab to get to my house at 92.
Wow.
In the middle of a pandemic. Now, this is the same person that can't remember to take his medicine every day, but he had my address, right? And so you talk about that connection and what people are willing to do. And here was somebody who was willing to do whatever it took to get to his youngest daughter.
Wow.
Because I couldn't fly home. I was saying no. And I kept saying, no, Daddy, you can't come. Well, now I won't let him go back because we're still in the middle of the pandemic. But I also have a 92-year-old at my house that I have to take care of. Those relationships are not going to be difficult to mend at the end. And I understand what the person is saying, but the people who you haven't seen will be so happy to see you, just as happy as you are to see them when this is. Can you imagine the people you haven't hugged and the people that you haven't kissed their cheeks and the people that you haven't been able to hold hands with or pray with or any of that, to be able to be in their presence again? And them to be like, yeah, well, you didn't come see me during the pandemic, when all of us have gone through the same thing. We are waiting to be able to connect again,
right? Because
that's what we do.
Yeah. And I think that, it's part of the waiting to connect in some of the old ways, but it doesn't have to be hour-long Zoom calls for everyone, but also connecting in new ways. So yes, I'm not having, I'm not pulling down and having my lunch down with Dr. Hunter, but then I will maybe send her a Teams invite and just say, we're chatting. It's not a meeting. There's not any specific purpose, for this time, but there is this catch up that, that we used to do with coworkers and colleagues. There was the meeting before the meeting, there was the meeting after the meeting. And, and there was the relational piece that could be lost. And I love the Hope is Not Canceled streaming.
I know, me too.
But I think that you can still find ways to do that. So we just, I'll just hit the Teams button or something, or send a little Zoom. Hey, are you free? The same as well with, I'll drop a birthday gift off at the, Dr. Hunter's front door, and by the way, and call, and she's like, what's that color out there? And then all of a sudden I'm gone, and then, she's calling me while I'm driving away. But there's stuff like that goes on that says that, relationships don't have to be broken during this time. Like you said, I mean, there are friends that I haven't talked to for years in college, caught back up with them caught back up with them and said, I just want to check in with you. And if it's a real relationship, they'll still have a heart for you.
Yeah, I think that you have to be intentional in this season. When somebody pops to your mind, call them. What I mean? Somebody pops in your mind, don't hesitate. We have another question from the audience. All right. How do we inform our kids about the dangers of the virus without stressing them out and making them afraid to breathe fresh air? Great question. My granddaughter called me and said, Grandma, it's the pandemic. No, she said, it's the COVIDs. COVIDs outside. I can't come out. It's the COVIDs. So I think that there is a way, because I had to share with her, you can put on your mask and you can still go outside, And so, it's a way that we have to share that. But I want you guys to touch on that.
Sure, you actually did. You just answered the question. Right? So I have my goddaughter, bless her heart, I love her to death. The only place she will come is to my house, right? Except she lives in Brooklyn, New York, because she feels like my house is a safe house, right? And a part of what she's dealing with, though, came from her mom. Her mom was so stressed about COVID and getting sick. She's probably the only person I know that takes a test on a regular basis, right? Because she's so afraid of getting it. So she watched her mom stress about this and have all this anxiety. And then her mom was like, you want to go out? She was like, nope, the COVID's outside. I'm not going outside. And she's like, but it's fresh air. She said, I'm okay right here. When we normalize this as much as we can, then it makes it, again, we have to set the example for what children will do. So like you said with your grandbaby, you put on a mask, and we're better when we put on our mask, and we could go outside and we could go for walks, or if we need to go to the grocery store, that's what we do. We have to show them, we have to be the example, because that anxiety comes from the parents, just like we teach our kids fears and we teach them all kinds of things. And so when we are the positive example for them, then that's what they go by, the positive example that they see. So you're like, yes, COVID is outside, but we're going to put our masks on and we're going to be safe and we're going to go outside and we're going to be okay. And then you take them out a few times, and that reinforcement, so that they know that you can go outside and come back in and you'll still be okay. And you keep reinforcing that, and they're all right with it.
And you make it fun when they're washing their hands. We made masks, you know what I mean? So even, giving them some arts and crafts or some things that they can do to make it relatable for them.
Sing a song when you're washing your hands or something like that. Make it fun. So and it's about protection too. It's like, you go outside and you say, you look both ways. Well, we don't say that is something that someone, that you could get killed by a car, right? You definitely could get killed by a car, but people aren't in constant fear of it, right? And so it's just the same way that you look both ways and you do these other things that you do to stay safe. This is just one other thing to stay safe. And I think the key part is you focus on the staying safe, is that we can stay safe when we do things to keep ourselves safe, and we don't focus on we're protecting ourselves from something that is so bad, something so negative, it's so horrible. And also the big piece too is limit the news, right? Yes. The first thing is this is the newest, this is the latest number. We've broken another record. This is how many deaths. This is how many, and they're going to go up. This is not rocket science. It's going to go up, and we know this. But so we want to make sure that it's very controlled for them, and that they can get a realistic view. But not everybody needs to take in that much, and especially if you're watching. So you're into watching like cable news networks where it's on constantly. Just make sure that you're monitoring the news as well.
That's good. I did see someone talk about having her husband, and she's in California, so she's learning from those of us that are in Maryland. That's the awesome thing about the World Wide Web, that we can share this message across the world. And, I know we said to go to the Prince George's Health Department for those who live in Maryland, but of course you can go to your county's health department as well to get information. But she talked about her husband having COVID. And so how to deal with someone who's living in the household with COVID. So what do you have to say to the person at home caring for others while quarantined?
Well, I can tell you, I know 2 people whose husbands had COVID and nobody else in the house got it.
Wow.
And so what you do is you have to quarantine that person away from everybody else. So one friend I had that's here on the East Coast, the husband stayed in the basement, and she took the food. The basement had, it's a finished basement. For those of you in California, they didn't, just throw them down there. But he had a bathroom with a full shower and everything that he needed. And so what she would do is she would put her mask on, and she would put on gloves, and she would take him food. And if he needed something, he would text her, and she would take it to the door, and she would leave it there. And they would spray the Lysol down the stairs, before and afterwards, to make sure that it was safe. Another instance, they didn't have that, and so the husband stayed in the bedroom, and so the exchange was made. It's made at the door. So he stayed within a bedroom that had a bathroom, and they would leave the food at the door. And then after they left, then he would take the food, and then he would leave the tray and things like that. Again, you have to wear a mask when you go. They were wearing masks when they went near wherever the area was, and they protected themselves. But you do everything that you're supposed to do. And everybody doesn't have the convenience of somebody being able to leave because of COVID. And you can still stay safe. In both of those instances, nobody else in the household got COVID, and the person who had it recovered at 100%.
Amen. Amen. You have to alter some things, but you just have to make it work, and you have to do what the CDC is asking us to do. We were talking to some professionals last week about it, and it just seems so simple. The reason why people, feel like it's not that deep. Like you have, wear a mask. Yeah. Wash your hands. Yeah. Stay 6 feet apart. It's a simple thing, but it works. It works. I promise you. Outside of me doing my show here at home, going to the grocery store is the only place. It's the only place I'm going, because I want to make sure that I'm following the guidelines and that I'm not just out here, And our household has been, we've been pretty safe about it, just because we are following the simple guidelines. What are some other behavioral health issues that you've seen in the pandemic that we might not be aware of, that did we not talk about any of them? I mean, we did talk a lot about them, but if there's something that you want to share.
Well, I know we also, a lot of people take for granted that their homes are safe right now, right? That, when you're staying at home, that this is a safe place for you. And unfortunately, if you're quarantined with an abusive spouse or an abusive partner, or there's children that are at risk for child abuse at this time as well. We just want to also remind people that the Family Crisis Center and that our intimate partner violence hotline, they're still available. There are ways to stay safe. I think that people can feel very helpless in this time, but that those in Prince George's County, they are very clean. They are very, taking all the precautions. And so, if there's a needs to be out of the home to be able to stay safe, we talk about our mental health, but if you're in a place of abuse, then there's only so far that your mental health can go. And so you want to make sure that you're focusing on not just COVID, but all of these other factors as well. And I just want to also mention that for those who are not in Maryland, that there's a national line, the National Suicide Prevention Line, and that's 1-800-273-TALK. And you can also text that line to 741-741 as well. But you're not at not in Maryland.
So even if it's not for suicide and it's more behavioral, they can still call that phone number?
Yeah, they can actually call, and they can also just talk to somebody. I've had people who have been my patients who have just called just to talk through some challenges, and they'll be able to just help and support individuals. And so it doesn't have to be just for suicide. It could just be, I mean, it's a prevention lifeline. And so it's a lifeline. It doesn't have to be if you're feeling like you're at a suicidal point.
Awesome. Awesome. Dr. Hunter, did you want to add to that?
I know that was one of our points that we really wanted to talk about is the intimate partner violence and the children who are at risk. I also want to really stress that well, we've talked about it a lot today. There's a huge stigma within our Black and Brown community about seeking help, seeking professional help for behavioral health. And I can tell you, as one who grew up in the church, was very much a part of the church. I'm a fully ordained clergy. I'm a pastor in my own right. And I ended up in this field because I had people who would only come to the church, and I realized I wasn't trained to deal with some of the stuff that was in my congregation. And so I share this to say, if you really need help, there are people who work in this field that understand your faith-based, as you can tell that tonight with Dr. Shaw and myself, who can still help you get the help that you need. So we find a way to bridge between what our belief is and the science that you talked about earlier to help people be healthy and whole. And that's our hope for them. Even within the scientific community, the one thing that we know is spirituality is such a great coping mechanism.
Right.
And it's something that can fuel us and sustain us during times when nothing else has. And so I would just ask that if you find yourself in a position, don't allow the stigma to hold you back. Really seek out the assistance that you would need in order to be healthy and whole, because scripture says there's nothing new under the sun. And if you go through and you look through the Bible, there are lots of people that have mental health diseases or disorders. I shouldn't call them diseases, but disorders, and God still used them. So it didn't matter that you may have a diagnosis. You're not your diagnosis. You are who you are, and God will use you exactly where you are.
Jesus and therapy are not mutually exclusive.
That's so good. Come on with these liners, girl.
They're not mutually exclusive.
Gwen Murphy asked this question: does Maryland offer a place to stay other than the hospital for people who have COVID-19?
I think it's county by county. So I can tell you for Prince George's County, we do have a place for people who are COVID-19 positive. So you would have to check with your county health department. Not sure what county you're in, but I know within our county, we do have a place for people.
And what's a website or information? Is it the number that we've been sharing that people can go to if they need to have that question answered as to where to go?
You can call 311 or our coronavirus hotline, and I can't believe I've forgotten the coronavirus.
It's the same as 311 now.
It's not. That's right. They put it into 311, right? So that's right. But they will connect you to a place to be quarantined. And then also, if you test positive in our county, we have some special programs where you can get some cleaning supplies and the coveted toilet paper and things of that nature, and some things if you are testing positive and have specific needs. And so there are special programs like that, the COVID Care program, and there also are some programs. And if you test if you need to be quarantined, and that's found through our contact tracing, then our contact tracers can help to connect you to that location as well. So and it's just county by county about what types of resources there are available.
That's really good. That's really good. So I know we're wrapping up. I was trying to get him to cue Wendy Carr's question because this is a really good question too. I'll just pose it to you guys. There it is. Thank you. What to do in the winter months with COVID still around to make your home safe? Ventilation systems. She said, I hear humidifiers are good.
So I have an air purifier, and you can order them. Amazon will deliver it right to your home. On the nice days, I would still say open your windows and let the fresh air come in. But you can don't forget, at the beginning of every season, you should change all of your what are those
filters?
All your filters, and of course, you get what you pay for. So, and during this time, you kind of want to get the ones that filter out everything. So don't forget to change your filters, add an air purifier. I'm not sure what the humidifier would do. I don't know if Dr. Shaw would be able to answer that.
Yeah, and I think, there's some data about dry nasal passages and increased risk of, and like that's part of what, why we get more colds in the winter and things of that nature. But I think the other piece to remember is that we keep to the basics about the social distancing and the masks and things of that nature, and that, we can have better circulated air, but we want to make sure that we're introducing as little as possible into that air. So I just think we want to stay to our basics. I know it's going to be hard. It's because, you're going to have not only the cold, there's the seasonal depression piece for a lot of people that some people typically can get more depressed towards the winter. And then a lot of us our creativity in our way to stay connected to people. Our creativity included staying, going outside. So, having outside socially distanced events. There were still risks with those events, and people still needed to be socially distant outside, but that was a way that people tried to mitigate some of the spread and decrease the risk as well. And so without being able to go outside and have a 6 foot away, chat on the porch, then it's going to be more difficult. And I think that, just like Cheryl said, it is about the intentionality right now, about trying to stay intentional and doing some unique things to stay connected, even though we can't do things the same way.
That's so good. I love how our audience is interacting with us. So we do have another question before we get out of here.
I was going to answer that.
Any suggestions for things we could do if we hear of a family member or a church member who has tested positive to help them?
Yes. So here's no different than what we were talking about with the person who had somebody in their home. Usually if somebody's at home and they've tested positive, this virus knocks you on your tail. You're very tired, you're exhausted. Drop off food. And if they're not near you, order food, Uber Eats. Send them some of the things that they would need. You can ship supplies to their house. You can support them you can't be there to go in and take care of them the way that you normally would, but you absolutely can make sure that they don't have to worry about where the next meal is coming from, or whether or not they have enough toilet paper to last another week, or whether or not they have enough paper towel. We are in an environment now where everything is done through a computer and everything is delivered to our door. Be part of the solution for them, where they don't have to worry about those things, and you take one less thing off their plate, and you make sure that they're eating and they have their basic needs are cared for.
And I think that as far as what to say to people too, is to remind people that there is hope, right? We talked about hope is not canceled, but this, just because we see on the news all of the stories of the people who are passing away from this virus, that there are still a lot of people that have a time limited illness, an illness that comes and goes, and that, it doesn't mean that we should be less safe, but it does mean that we shouldn't assume the worst. So when we think about stress and its impact on that, on this disease, on the impact on our behavioral health and our impact on our body's ability to fight this, that we don't want to start thinking to the automatic worst. So I think that's one thing. Another piece is that if a lot of us live in multi-generational households, a lot of us can assume that we have extra space so that if we, need to quarantine, or someone in our family needs to quarantine, then we can have someone go to a fully finished basement with a bathroom on their own. Not everyone has that available. And obviously, this is on a situational by situational basis, but I know of a family that someone tested positive, and they were living in a 1-bedroom household with, 2 families, for example. Then it said, I have a 5-bedroom home. They can come to my basement and safely quarantine there, and I feel comfortable that won't impact my family, because they truly can be quarantined there. So also just thinking about some of these things that we take for granted, and that's part of why our community has been affected so much in Prince George's County, is because not all of us have these McMansions that give us the ability to quarantine. And, and a lot of us are still working, right? A lot of us are essential workers. And I think that's the other piece. I saw somewhere, I think it was on Facebook, someone said something that essential worker is a euphemism for a sacrificial worker, right? That you are making a sacrifice, and for us, or for our society, and doing whatever you do. And we just want to make sure that we don't assume that everyone has the same resources and can ride this out the same way.
Mm-hmm. We're wrapping up now because we're at the top of the hour, but I do want to touch on the vaccine, because I did see some folk who were on the line who had some reluctancies. I want to give you both the opportunity to touch on, as our final comments on the vaccine. Many are very anxious about it because it's such a new vaccine and it's happening so quickly. What do you say to those who are fearful and or conflicted about getting vaccinated?
Well, first, I want to say that, there is, I don't want to minimize anyone's fear. That's the first thing as I want to do, is I do want to acknowledge that I can see why there's fear. I was watching the news and somebody mispronounced Tuskegee. And I was like, this is why Black people have fear, because you don't know how to pronounce Tuskegee. So,
that's number one.
So, I think that it's fair to acknowledge it, and I'm glad that we're having this candid conversation about it. I think that we do have an FDA. We have a regulatory agency that is charged with with safely analyzing data. There have been several companies that have worked towards this vaccine. This has been an international race towards one goal. And so, this is not just, especially for people who are fearful about political aspects of this, that, this has been a multi-country effort and not just our country trying to get here. And I was on an event yesterday where Anthony Fauci spoke, and Dr. Fauci mentioned that part of the reason that this has gone so fast is not just because of that we fast-tracked any data, or we fast-tracked the trial piece, but some of the technology has been able to be faster because we put their money, resources, and the technology, because of where we are right now, has an additional ability to do things faster. I'm also reassured that there are several vaccines with similar efficacy, and so it's not just one company as well, and that so there are many reassuring points. But you have a choice in whether or not you take the vaccine and when you take the vaccine, and so I think that there's not necessarily a force there. And so I just want to say that this is another way to stay safe, but this is a way that helps us as a society as a whole to come out of this. So I think that, the fear, I understand why there might be fear, but there is also a lot of good data from multiple sources. And that you take the choice and you make the, we're taking a risk every time you go to the bank. You're taking a risk every time you go to the grocery store, right? And so there's all of these have a risk-benefit ratio, and you have to decide them for yourself.
Dr. I'll give you opportunity as a final thought as well.
I do want to emphasize what Dr. Shaw said, that we have a choice in this. And I think sometimes people think that they're being forced to do something. And medicine has come a long way. And they, what happened with Tuskegee and other trials can no longer happen. There's so much, especially we can, you talk about us being scientists, and I always tell people I'm a mad scientist at heart, right? I know what goes into doing human trials. I know what goes into doing human trials where no medicine is involved. So when you talk about a vaccine and all the hoops that you have to jump through for that, this isn't a small feat. This is a huge feat. And the fact that it was a worldwide effort for something. And as Dr. Shaw stated, we have not just one vaccine, and not just two, but right now a possibility of three, and they're all showing similar results. So it doesn't happen like that. This is not by chance. And I'll even add that they can't say, oh, it's a political move, because if that was the case, we know that the person who was running, the United States was saying he was going to have it before, the election. So no, the FDA is not pushing it through for anybody faster. They're going to do what they need to do to make sure that we're safe. They are the regulatory board, and we have to trust that. And even if you don't understand all the science behind it, you have to know that in this case, you still have a choice, even when you get to the end of the science.
I had an opportunity to talk with the chairman of the FDA for my community affairs show here at Praise 104.1. And our viewers can check that interview out on our website at praisedc.com. And he talked extensively about the processes, even with the emergency authorization that they just approved for them to get the vaccine out quicker. He still talked about the extensive things that they do in order for them to approve a vaccine. And it was very reassuring. Not only that, but it gives the average person an understanding to see how this goes about. And the truth of the matter is they had already started working on vaccines for coronavirus, because it was a virus, but it had mutated into this big pandemic thing, which is why they were able to rush it as well, because they had already started the process of these kind of vaccines. So you have to educate yourself, family. You have to educate yourself and kind of stay off of the conspiracy theories that you're finding on social media, because everybody has a conspiracy theory about everything. So that's it with it. I thank you guys so much for being candid, for sharing even your faith with regards to the pandemic, your professional expertise. I really, really appreciate it. And the fact that we all girls don't make it, isn't a bad thing either, right? Some Black girl magic in the room. That's not a bad thing either. So yeah, hashtag hope is not canceled. I like it. You guys share this platform on your platform. Share it. Tell everybody about it. It's going to live on our website. It's going to live here on our social media pages as well. So make sure you share it with everybody. That's how we're going to get through this, is if we learn the facts from the experts. I appreciate you guys. Thank you so much. We got to do this again. This was great. All right. Follow these doctors on social media so that you guys can connect as well.
Thank you so much.
That's going to do it for us tonight for our heart-to-heart discussion on behavioral health here at Praise 104.1 and Spirit 1340.